All right. The chair would like to call the Health Committee meeting on October 10th, 2024 to order. We have 5 members present, so we do have a quorum. Do we have any members of the public?
We've had no requests this evening.
Thank you. Item number 3 is a consent agenda. Do I have a motion for the consent agenda? Motion by Johnston, second by Hanson. Any comments? Hearing none, we will be voting on the consent agenda. All in favor? Aye. Any opposed? And the consent agenda is approved. Moving on to departmental matters, 4A is Alana Strum from Advanced Correctional Healthcare and Diane Hughes from the jail superintendent. Alana's not here, but we have Diane.
Good evening. I presented the report that Ms. Strum put together. Additionally, we have the memorandum of understanding for the Illinois Medication Assisted Recovery Learning Collaborative Grant. Mouthful. I brought Jackie Mathias if anyone has any questions. She's the one that applied for the grant. It's for a $30,000 increase, which will help get some medication and supplies and training related to medication-assisted recovery.
Okay, thank you. Yeah, that was approved at Justice Committee Tuesday, so it'll go through the process here. Anybody have any questions for Ms. Hughes? Go ahead.
Just a quick question, looking through the statistics, I noticed that there was an increase in our medical grievances on page 8. And I'd noticed it last month, but it was kind of an anomaly, but this month it's a second. So I'm just curious if there was any information we could find out about what's causing the increases or what needs to be addressed.
Some of the increases may be due to certain individuals who file repetitive grievances.
Okay.
A lot of the time it's the same individual who will keep filing the same type of grievances. A lot of times that's what it has to do with.
Okay, but that person's been in for 2 months now?
Hmm?
Has that person's been here for 2 months with us?
There's several
Okay.
different people that may be involved in doing that without getting into names or anything, but
Okay, all right, thank you.
Anyone else have a question? I do have a question, and maybe Jackie might be able to help too on that. Because I noticed that we've, pretty much now hanging right around 50% of the people in the jail are on psychotropic meds. And I believe last month when Jackie was here, she mentioned that you're working with DHS. Can you explain a little bit more about what you're doing with DHS on that, because of those people that are been found unfit to stand trial or not guilty by reason of insanity, and that they're waiting for a bed. And so I'm kind of curious, a little more detail on that, if nobody minds if Jackie talks. Okay, thank you. Go ahead, Jackie, or Diane.
We're still in the process of trying to work with DHS. I'm still back and forth with them. What we're hoping to get is some training on the fitness questions and counseling they get when they go there, so that for those individuals that are with us that start the medications or are willing to work with us, we can start that process, because we do at times have people found fit in custody, meaning they never have to leave us, and that makes it a much shorter and quicker process. So that's what we're trying to do. We're not there yet. The other part of what we do now currently to try to move the process along is we do have a good relationship with our DHS evaluators that come to see people for pre-placement and those types of things. And I send regular reports on how everyone's doing and who's doing well, and they trust our reports as far as if someone seems like they're getting closer to being found, could be found fit, even with what minimally we know about the counseling process, to come and reevaluate them and get them taken off the list and move forward with their court process. So we're still in the process of it. It's not established yet, but that's the goal, is to get a little more training for us, so maybe we can help prepare them and shorten that list, kick people off of it so they're not waiting so long.
Okay, thank you. That was a good explanation. Anybody else have any other questions? Okay, Thank you. Moving on, 4B is Jessica McKnight, Health Department Administrator.
Hello. So you do have my report, and it is the program statistics from July and August that were presented during the September Board of Health meeting. So happy to answer any questions.
Does anybody have any questions? Okay. This should have been under, I'm like, wait a minute, that should have been under A. The MAR grant information is what Ms. Hughes was talking about. Okay, moving on, Tim Wiley, Nursing Home Administrator. Oh, you have an item for action. C1A is request approval of a hospice patient respite services agreement between OSF Healthcare System, OSF Hospice, and McLean County Nursing Home. Do I have a motion? Motion by Burns, second by Hanson.
Hello, everybody. We've had a long-standing agreement with OSF Hospice. This is simply increasing our services with them to include respite stays.
Yeah, go ahead.
So kind of looking through it, it is the standard kind of administrative agreement. Is this something that is solely available to like OSF patients then? And would they have to apply through OSF to get the respite care?
Each one of our hospice providers has respite care.
Okay.
With our other hospice providers, we already had respite agreements in place. And we just found out recently that with OSF, we had been entering into a respite agreement, a single life agreement each time we had an individual. This way, we don't have to go through the agreement process every time an individual is coming for our temporary care while family members get a break or need to go on a trip or things of that nature.
Okay, thank you.
Any other questions? Hearing none, we're going to be voting on the approval of respite services agreement with OSF. And all,
Hey, Susan, I had a quick question.
Okay.
for Tim. Just for clarification, is that close? Is that close to palliative care, the respite care?
That's a great question. So respite care actually gets its name from the rest or the break that it provides the person's caregiver. So if an individual is on hospice and let's say the spouse or an adult child has been the caregiver, and that caregiver either needs a break or needs to go on vacation or go away to a family event, then we provide the care for that person temporarily, and then that person returns to the care of the caregiver at home.
All right, so I guess it's
It's full hospice care. It's
subcategory
full
of
hospice
hospice
care,
care. Okay, thank
but
you.
it's just for a short period of time.
okay, so now we're going to vote. All in favor? Any opposed? Okay, and that is approved. Now you have your monthly report.
Just one thing to highlight, related to another, is we were really encouraged to see our Medicare A and HMOA census stay strong, and the revenue numbers for the month of August reflect that. We did have a little bump in our agency utilization, but you will see in September and in October's numbers that we have it back down significantly. It was just due to some turnover in that period. I'm happy to answer any other questions that you might have.
Questions? I just want to make a couple of comments. That we received the treasurer's report today, and it's looking really promising. It's been pretty good all year, and we're now into October, so let's kind of keep our fingers crossed. We're going to be positive this year, at the end of the year. I didn't know if you were going to say anything about last week or not. Or
I'd be
did
happy
you want me
to.
to?
Last Thursday and Friday, we celebrated 50 years at the 901 North Main location. We had a ribbon cutting with the Chamber of Commerce on Thursday that was lovely, went very well. Thank you, those of you who were able to attend. And then on Friday, we had a reception out in the courtyard with, we had the residents out there for a while, and then we opened it up to visitors. And our best guess, we had close to 45 people from outside the nursing home operations attend that, including some of you. And I must say that it was very touching to see some of you. I know Tony spent some time with one of our residents, a 100-year-old World War II vet, and thank you. That was moving to see that interest and that involvement and that interaction. But it was a great time. We have a banner up that says "Cheers to 50 years at 901," and we're going to leave that up for probably a year or until the weather takes it somewhere. But it was a very exciting time.
Yeah, I do have to say it was really nice. I think, was it you that, and Ms. Taylor and you were the ones that did the ribbon cutting? Okay, actually cut the ribbon with that gigantic scissors.
Yes.
So, yeah, it was a really nice event on Thursday, and then also then on Friday when I went there too to see people and had great food and loved the ice cream machine.
Yes.
And
Yes, and
so-
thank you, Ms. Schaefer, for attending as well, for all of you that were able to make it. It was a great time, even though they did not allow me to run with those really big scissors. I was a little disappointed about that.
Okay, thank you. All right, moving on is 4D is Jason Tabb, Juvenile Detention Superintendent.
Good evening. I have no action items. You have my monthly report. I'd be happy to answer any questions.
Are there any questions for Mr. Tabb? Okay, hearing none, thank you.
Thank you.
Moving on, we get to the real fun part of this month, and this is the County Administrator, Cassie Taylor. Do you want me to read these and then? Okay. So first item is 4E1A is request approval of tort judgment fund 0135, Department 77, fiscal year 2024, recommended budget for juvenile detention medical program 2022, 22, and jail medical correctional health services program 73. And should that not be 25 budget?
It doesn't mean year 22, it's a program number?
No, this one here. Right here.
Oh, yes.
That should be 2025 recommended budget. And then I'm going to turn it over to Ms. Taylor.
Very good. And thank you, Joe. So we've pulled up the Health Committee budget presentation. We will be covering the 4 departments that you have oversight for here. The budget for the Juvenile Detention Center Medical Department begins on page 42 of your packet. Next, the medical budget for JDC provides access to mental health services, a staff RN for sick call encounters, for dental screenings, and for TB testings. The budgeted expenses total $127,376, with 59% of this budget accounting for salaries and employee expenses. As you can see, this pie chart does show expenses. We had overall expenses for this division showing a 2% increase that was related to salaries and employee costs. It's a pretty simple budget. For jail medical, that starts on page 46. And as you can see here, total expenses for this budget is a little bit higher than JDC. It's $2,323,290, which is a 5% increase from last year. The salaries here support a full-time administrative specialist 2 position. That is the only McLean County position that is included in this budget, because as you'll remember, in July of '22, jail medical services were contracted through ACH Healthcare. So the contract lines do include all of our nursing staffing as well as the medical director fees for this department. Services for this fund are 80% of the budget and account for that ACH contract as well as any other contracts that are needed. That contracts as a whole increased 16% this year. Vaccine prescription lines include injections for mental health patients with costs reimbursed for those services through our Mental Health and Public Safety Fund. And we do have one recommended amendment to this budget on page 47 of your packet. In the non-employee medical expense, which is 757.0001. That is currently budgeted at $200,000. We would like to reduce that to $133,000. And that is due as a result of Advanced Correctional Healthcare being able to scrub the bills for us in that line. So we thought there could be additional reductions that we missed on our first pass. So line 757.0001 should reflect 133,000. If it so pleases this committee. And that is it.
So was that offset in the revenue,
So the,
or was it already included in the revenue or to balance?
we'll update the property tax, which will be at executive.
Oh, okay.
Oh, up on the top. Why don't you take over for that one? No, she's. Kathy Dreyer will be adjusting the general property tax on page 46 of your budget to reflect that change as well. Did you? Okay.
Okay, so I didn't do a motion before I gave it to Ms. Taylor to talk about it. So can I have a motion now? A motion by Member Byrne, a second by Member Johnston. Did we want to have a motion on an amendment to that? Motion by Hanson, second by Knapp. And the motion would be to make the adjustment as recommended by county administration. Okay.
So on page 46, the general property tax should be $5,688,571.
Okay. Any other questions, comments?
Was the property tax revenue supposed to go down?
Yes.
Okay, just making sure.
Okay, $5,554,571. Sorry about that.
Any other comments, questions? Okay, first we're going to be voting on the amendment to the budget with the $5,554,571 on the property tax, and then the $133,000 on lines 757-0001. All in favor? Any opposed? Okay, and then we'll move back up to the original motion for the Tort Judgment Fund 135, Department 77, for juvenile detention medical 22, and jail medical 73. All in favor? Any opposed? Okay, got through that one. Moving on, 4E1B consists of numerous items. If the committee has no objection, I would like B1, B2, B3, B4, B5, and B6 to be combined. Okay, there's no objection. So that would be request approval of the Health Department 0061 fiscal year 2025 recommended budget, including, and I know that Chuck didn't read them all. Do I have to read them? You don't. Okay, including B1, B2, B3, B4, B5, and B6. Can I have a motion, please? Motion by Hanson, second by Johnston. So that's all as far as I went on this one. Thank you.
Thank you, Chair Schaefer. So I'm going to show the PowerPoint for all of the programs that we have. I'll stop when we get down to Personal Health Services Program, and then pick it up from there. But some of these are aggregate totals. So beginning on page 49, the tax levy information, 2024 versus 2025, is listed there with a breakdown of the tax rate, indicated how it will be allocated across all of the health department programs. Overall, the aggregate tax levy for 110 and 112, that rate dropped 1.4%. And the health department is utilizing fund balance where appropriate across these programs. For revenues in 2025, the total budget is $10,420,619. It shows you there the tax rate and also the revenues by source. The largest revenue source clearly is the general property tax, and next would be intergovernmental agreements. The 13% fund balance here is what fund balance has been used across all their programs. So that does include grant funds. Moving to the next slide, the health department expenses. On the left there show you the total expenses for the department. The next two pie charts have it broken down by special funds, which are primarily grant supported, and then programs primarily tax supported. Both may have some charges for services or fees associated with those programs, but you can see the difference in grant funded versus property tax supported programs. The grants account for $3,230,763, and programs primarily using levies account for $7,189,856. And that is at the end of the slideshow.
Thank you. And one of the reasons I did 1 through 6 was because those were primarily the grant-funded programs, and the other ones have more to do with the property tax. So that's why I broke those out that way. Are there any questions? Member Johnston.
Thank you. Just kind of looking through the budget, there were a couple of pieces that sort of jumped out, and I feel like they are part of kind of an expansion program, but I just want to make sure. First on page 51, this is under the dental program. We did see a pretty percentage-wise increase on the maintenance buildings and equipment. And I was wondering if we could just kind of walk through what's going to be expanded in that for the extra money.
So this is line 744, maintenance, buildings, grounds, equipment.
That is correct. Yeah.
And that is in the dental program account. So I have a note here that this was adjusted to actual expenses and the IEMA annual invoice for dental radiation equipment needed. And then there's a programs portion of a new first floor switch plate that equals about $1,834.
Okay. All right, thank you.
And I'll turn to Jessica McKnight if there's any other additional, as we go through these funds, if there's additional information you'd like to highlight or share.
Okay. The other piece is on, under item B6. And so that's going to be on, where are we?
109.
No, I'm sorry, B5. So on the next page, on 67, we've got 622.0001, medical and nursing supplies, increased to just over $12,000 on page 67.
So I believe that's a grant, the RSOR grant for COVID and Tamiflu, and I'll turn that over to Jessica to explain.
Yeah, exactly what she said. So it's a grant for respiratory surveillance, and so through that grant, in the budget is for COVID testing and Tamiflu if we need to respond to outbreaks of COVID or RSV, et cetera.
Okay, and is that state grant funding?
It's, yes, second
Okay.
page.
All right, thank you.
Any other questions? Hearing none, we'll be voting on 4E1B, B1, B2, B3, B4, B5, and B6. All in favor? Any opposed? Okay. Moving on, we're going to 4E1B7 is Persons and Development and Disability Grant Fund 110, Mental Health Program 60. And can I have a motion for that, please? Motion by Johnston, second by Hanson. This is the 377 board request. Are there any questions on that? Okay, hearing none. All in favor? Any opposed? Okay, that one. The next one, I'd also like to combine them together, is E1B8, B8.1, B8.2, B8.3, B8.4, B8.5, B8.6, B8.7, B8.8. Can I have a motion for that? Motion by Johnston, second by Hanson. And this is the bulk of the property tax is in the 112 fund. So are there any questions on that? I see the red writing.
You see my notations. So looking down under B4. Where are we? On page 87. This is the line item 07060004. This is the contract services. I just wanted a reminder about what these services were for. The RUM.
So RUM stands for Rent, Utilities, and Maintenance, and so that amount is based off of the number of FTEs in a program and estimated on the monthly average of annual utilities and maintenance required.
So but we are doing a lot of work over at the health department, correct?
Yeah,
So that's
recently,
what the
yes.
increase is, okay. So that was one of them. The other question I had was, in the health promotion programs, I'm all for getting extra education, but we did quadruple the budget there, and so that is item in B6. Yeah, on page 94, 0612.0003. And just curious, like, what we're seeking the education for.
So I'm seeing this, education materials are car seats. So we had 10 each a month of car seats and play yards, as well as employee wellness giveaways for our annual employee wellness fair
Okay.
that we partner with the city of Bloomington. And then there's also some outreach events, which I'd have to turn over to Jessica to detail some of
Sure,
those.
yeah, and if I may, the car seats and the pack and plays for safety, it is being moved from a different fund. So it used to be coming out of a grant fund balance that's not there. So we're moving it to continue the program.
Okay.
So that's why there's a significant increase. It's something that we were doing, but it's now coming out of a different line, different fund.
Different fund, okay, thank you.
Anyone else? I do want to make a comment since Ms. McKnight mentioned fund balance, and that was last year we had lowered the levy for to utilize more fund balance, and when we got the annual report, we did accomplish exactly what we wanted to do with that because of the way they were budgeting things and things like that. So I have to give a lot of credit to Ms. McKnight and her budgeting, and then also following through with this year too, with the budget to try and reduce some of that fund balance. So I do want to make that known to the committee that they are, the Board of Health and Ms. McKnight are watching that very carefully. So anything else? If not, we are voting on 4E1B8, which is Health Department Fund 112. All in favor? Any opposed? Okay. Thank you.
Thank you, Jessica.
All right, moving on for E1C is request approval of the Nursing Home Fund 0401, Nursing Home Department 90, fiscal year 2025. Recommended budget including C1, C2, C3, C4, C6, C7, and C8. Do I have a motion? Motion by Johnston, second by Hanson. Ms. Taylor?
Thank you, Chair Schaefer. So the nursing home for budget 2025, we have there just an explanation of the mission of the nursing home. It is to provide quality care in an atmosphere that allows both residents and their families to feel comfortable and welcome during the residents' stay. McLean County Nursing Home did celebrate 50 years this year in their current location, and they have a solid reputation in the community for providing consistent quality care. We intend to uphold that reputation by continuing to maintain and improve our standards of excellence for the next 50 years, hopefully. This is on page 103 of your packet to begin. So for revenues, revenues are listed there on page 120 because that's in the administrative section of your packet. But revenues for 2025 total $11,505,885. You have listed there the revenue by source. Intergovernmental revenues include your Medicare, your grants, reimbursements from the JDC. Charges for services, which is the largest source, include private pay services and public aid. And then you can see there what those percentages are in the pie chart. For expenses, as balanced with the revenues, the expenses for the nursing home, again, are 11,505,885, with 69% of costs going towards salaries and employee costs. Our capital assets from ARPA are being carried over, some of them into 2025 to complete the projects that we are finishing at the nursing home, but they will not be budgeted here in this year's budget. There'll be a carryover from last year's budget. So you can see there's 63% from salaries, 8% supplies, 23% services, and 6% fringe. Be happy to answer any specific questions with the help of Mr. Wiley.
Thank you. Does anyone have any questions on the nursing home budget? Awesome. So hearing none, we are going to be voting on the 2025 recommended budget for the nursing home, Fund 401. All in favor? Any opposed? Okay, and that is approved through budget. Yay. Next up, did you have anything else you wanted to say?
No, I'm just chuckling to myself for our next meeting date, so I'll let you continue on.
Oh, okay. Moving on to other business and communication. Our next meeting date is November 7th. Is that correct? 2025. Okay. I missed that one too.
No, it's 2024.
No, it is 2024. Okay. At 4 o'clock,
At a regular time.
at a regular time, 4 o'clock. Does anyone else have any other business or communication? Hearing none, this meeting is adjourned. Thank you.